the vaccine operation. So that's the reason why I was late. So sorry.
It's great, Governor. Great to hear your voice, and glad to hear that the outer islands, well, not the outer islands, but Tinian and Rota will be getting their vaccines very shortly. Go ahead, you have the floor.
Well, it's last day of the year, um, and cannot be more grateful than our community, uh, and so much things to be appreciative, and just life itself. I know that KSPN last night gave an award, a communities award to the COVID task force, to our hospital, our first responders. So I want to thank the community. Thank you for following the directives, encouraging each other, protecting each other, and fighting COVID with each other, not against each other. With that, I'm open for any questions or comments.
Ferdy, you want to start off?
Good morning, Governor.
Good morning.
So far, how's the feeling after getting vaccinated against COVID? Is there any side effect?
Governor, did you get that?
Yes, yes, sorry. Yeah, there is no side effects, no massive headache, no migraine headache, just a slight discomfort. And I think that's normal because on my left shoulder where I got the shot, other than that, there's nothing, nothing to be concerned. Okay.
Yeah, go ahead.
Yeah. So there's just discomfort. There's nothing, no side effects. And it's been almost going on 2 weeks, 2.5 weeks. So yeah, it's good.
Right.
Good,
And
Ferdy.
second question, Governor, please give us update with the second stimulus package.
Well, I know Secretary Dave is also Secretary of Finance is on the air. To my understanding, with we have to wait until we get the transfer of funds from U.S. and once we have that, then we'll disseminate that uh, immediately.
And third, Governor, please give us an update regarding the travel bubble. I know this will start December early. I mean early January.
We're still there's some documents and approvals that needs to be approved, and we're waiting for those approvals. Other than that, we continue to do our end here in terms of working with MVA and our private partner to have the plan executed the best we can. So we're just waiting for it. And again, all of this we are trying to promote CNMI, and but at the end of the day, it's a new norm of tourism.
Okay, that's it for now, Governor.
All right,
Happy New
thank you,
Year.
Freddie, and happy New Year.
Of Guam TV, you're on.
Hi,
Do you have any
Governor.
questions for the governor?
Sure, I have some questions. Good morning, Governor Torres. I guess welcome back to Saipan. I did want to ask about. I did want to ask about. You mentioned the vaccines. Can you tell us how many people have been vaccinated in the CNMI?
Um, I know that our CEO is also on the line. I believe she would have a more direct number, but I know that we have. I'm pretty sure it's about 3,000, if not more.
Wow.
2,709.
Okay,
2,000.
2,709. There you go.
Okay.
Yeah,
You
yes,
know,
thank you.
over here we've moved into the second phase of vaccinations, and now we are vaccinating our island's Manonco. But over there in the CNMI, can you kind of just tell us what the process was in terms of how you determined, I guess, which priority groups were to get vaccinated, I guess, first and then on down?
So maybe our CEO can also chime in, but we did prioritize according to CDC guidelines. That'll be the first responders. I know that our nurses and our doctors got their first opportunity to get vaccinated, and then there's certain tiers of priorities. And as well as government employees, the Manomco, we have that early on as well. So that was the first priority, was the first responders and that tier. But CEO can chime in.
Yes. Hi. So yeah, we did the first responders, healthcare workers, Manamco, and as numbers, we've been monitoring the numbers, and then we start expanding it to the other group. So we had added the essential workers as well, and we did reduce the age from 65 and above to 60. We are also looking at those that have are chronically ill, but for example, whether they're on getting chemo as well as dialysis. So we are covering those, and yes, thank you.
Yeah, when you said frontliners, you are referring to as well as like police officers, firefighters, right?
Correct.
Okay.
Yes.
Okay. Gov, then what about vaccinations in Tinian and Rhoda? Have they begun? What is the plan?
Do you want me to? Okay.
Sure.
This is Esther,
All
right?
so-
Esther Munya?
Hi.
Hi. Okay.
Sorry.
No, it's okay.
Yes, this is Esther Munya. And do you see my
There you are. Okay, I see you.
Okay, yes. So for vaccines for Tinian, we're going to start with Tinian. There is about 200 individuals that we will be vaccinating within either next week or the following week. We're working with the mayor office to basically roll it out. And once we get more Moderna, we only received about 400 doses actually, so we are going to be using the first dose and the second dose, and then we will, when we get more, we will also go to Rhoda. And it's still within our plan. We were looking at mid January to start it, so this is actually within our plan as well. So.
How many Pfizer vaccines did you guys receive?
We got about sorry, they keep changing numbers, but it's $9.75 per tray, but you can get a little bit more depending on what you can get out of one vial, right? So there are times when there's one extra or more, and so we had six trays. I can't even say it. 6 trays, but then we are making sure that it's we have the second dose available. The second dose is about to be rolled out on January the 9th, so we want to make sure that we have the second doses here available.
So Governor, you took the vaccine. You didn't grow a third arm or anything like that. So that's good to hear that you're fine. Have there though been any adverse reactions to the vaccine?
No, absolutely not. Like I said, the day I got it on Saturday. The next day is when I felt the discomfort. Again, nothing alarming. Just in fact, I was telling everyone that I got the flu shot a month and a half ago. That was worse than this vaccine. So again, absolutely nothing. No flu, no coughing, no sneezing. And so yes, I'm good. I'm good.
Mm-hmm. Well, what's been, I guess, the response over there in the CNMI to the vaccines? I know you said 2,700 had been vaccinated, and everybody has a limited supply, including here on Guam. But Just in the community, are you seeing people that want to get vaccinated, or are you seeing fear of getting vaccinated?
Well, we would like to encourage everyone to get vaccinated. And again, we've worked so hard as a community. We have sacrificed basically our lives, our loved ones, and we've always talked about vaccine. So now that it's here, we want to encourage everyone to take it. Government employees, private sectors, our retirees, our manamku, and every age in between that is able to get a vaccine. And if there's any health issues, we suggest to consult a doctor, and then we go from there. But we really do want to get CNMI vaccinated as much and as high percentage as we can.
And I know one of the other reporters had kind of touched on it. You guys are still on target. You just need to work out some or have more discussions about the reopening of tourism. And this is the corridor, I want to say, with South Korea.
Yes.
Okay, so
Again, here, yes, and it's just the understanding that when tourist comes in, that our community understand that this is going to be a new norm of tourism, as well as our tourists that's coming to the CNMI understands that there's got to be some changes into tourists, the way we do things post pre-COVID. So yes, we're trying to adjust on what that new norm, but it's important that our health priorities here doesn't change. And again, I've said this in the past that our system works, and that system does not and will not change in terms of travel bubble that comes in.
right, I think it's kind of obvious that the system has been working. I think the last time I checked, it was 122 total confirmed COVID-19 cases in the CNMI, and that is since March 28. So, yeah, you guys have been doing a really great job. I did want to ask, are you guys monitoring, or how are you guys monitoring this new strain that's being reported?
Very closely. And again, one of those concerns, those presents here. And again, we're going to go back again to vaccine, that we're seeing these stronger strains that's happening on our region. And really, regardless on what region around the world people travel, who's spreading this. So that's why I encourage everyone to get vaccinated, because you're not just protecting yourself, you're protecting your loved ones. So yes, we are concerned about the different strains and how strong it is.
All right. Well, thank you guys so much. Sorry, I didn't mean to take up so much time. Happy New Year.
No problem.
No, you're good.
Esther, we'll turn it over to our task force now. Esther, I think Warren will be on momentarily. Esther, go ahead. You have the floor.
Okay. Well, as mentioned earlier, we have 2,709. We are expecting a little over 200 today that have already registered. Again, for the Manamco, we always have an assistance, on-site registration assistance. We are expecting more vaccines, but until we see the shipping manifest, we will be making another arrangement for we'll be making announcement on when we're going to be doing more vaccines for the first dose. So we are working on the plans to get the doses to Tinian, and as well as working on the second dose. And, we continue to monitor our borders with our testing capability and quarantine requirements on site. So that's it, and Happy New Year to everyone.
Thank you, Esther. Appreciate all the great work you folks are doing. Ferdy, go ahead. You have the floor.
Again, that was the press conference with the governor of the CNMI. As you saw, that was Esther Munya with the hospital over in the CNMI, and I think it was David Italic, who is the the Commissioner or Secretary of Finance of the CNMI. We're going to cut out of that press conference. Thank you to the Governor of the CNMI and Gary for allowing us to zoom in and link in to their press conference just to kind of give everybody here. And we do have viewers in the